Hello and welcome to the second in a series of 4 videos on managing your chronic obstructive pulmonary disease, or COPD. My name is Susan Nilsson and I've been a registered respiratory therapist for over 20 years. I have seen patients in all different stages of COPD, and I have seen what a difference it can make in their quality of life when they are educated about their disease and how it can best be managed. I would like to start off this video talking about how a doctor might test your lungs for COPD and then go over medication and oxygen therapies that can be used to manage your COPD symptoms. When testing a patient for COPD, you will often hear doctors talk about pulmonary function testing, or PFTs, which check how well your lungs are working. There are different tests that show things like how much air your lungs can hold or how quickly you move air in and out of your lungs. The test can be used to diagnose COPD, measure how severe your COPD has become, or check to see how well your COPD treatment is working. The simplest and most commonly used lung test is spirometry. When this test is done correctly, it is the most consistent way to check how well your lungs are working. We often use spirometry testing to tell how severe a patient's COPD has become. Based on these tests, your doctor may describe your COPD as mild, moderate, severe, or very severe. As we mentioned in the first video, the best way to lower your risk of getting COPD and to help keep it from getting worse if you already have the disease is to stop smoking. Cigarette smoking causes about 85% of COPD cases in this country. There has been clear evidence that shows that if you quit smoking, you can help to relieve some of the symptoms of your COPD. It has also been shown that if you quit smoking, it is the single most effective way of keeping your COPD from getting worse. There are many different programs out there to help you to quit smoking, and I will list some of them at the end of this video. Many people find things such as behavior modification, nicotine replacement therapy, or drugs such as Zyban or Chantix may help them to quit. You just have to find what works for you and follow through with it. Remember, it might not work the first time or the third time, but if you keep trying, you will find what works to help you quit smoking. If you already have COPD, there are many drugs that are available to help you with your symptoms. The drugs most often prescribed for COPD patients are bronchodilators. These drugs relax the muscles around your airway to help relieve coughing and shortness of breath and make breathing easier. There are short-acting or rescue bronchodilators, such as albuterol or ProAir, that help you feel better quickly by opening up your airways. These medications act quickly but don't last as long, only about 4 to 6 hours. There are also long-acting bronchodilators, such as Spiriva or Ceravent, that are used to control your COPD, not for quick relief of your symptoms. You may also be given inhaled steroids to better control your COPD, so you don't need to use your rescue inhaler, like albuterol, as often. All of these medications can be used in different combinations to best control your COPD. This is an example of a nebulizer cup that can be used to give a breathing treatment in the hospital or with your breathing machine at home. You need to put the mouthpiece in your mouth and breathe normally in and out until you hear the medicine in the cup start to sputter to make sure you received all of your medication. This will usually take between 10 and 15 minutes depending on the type of nebulizer you are using. Another frequent treatment for COPD patients is oxygen therapy. Whether a patient needs oxygen therapy is usually determined by the oxygen saturation in their blood. This is often measured by a pulse oximeter, which is a machine that fits on your finger and uses a light in the oximeter to measure how much oxygen the hemoglobin in your blood is carrying. It is then calculated to give you a percentage reading on the machine. Patients who have an oxygen saturation of 88% or less at rest while breathing room air are often given oxygen to help them breathe better. The pulse oximeter reading of 88% or less is what Medicare currently uses to qualify patients to have oxygen covered by their insurance. Some patients don't qualify for oxygen while they are at rest, but may need oxygen with activity. In this case, the doctor, or oxygen home care company, has to prove the oxygen improves the patient's oxygen saturation with activity in order for Medicare to cover the oxygen. There are many different oxygen devices available for use in the home, and portable oxygen devices for use with activity, so there is something that will work for almost everyone. Oxygen is considered a drug, so it must be used exactly as prescribed by your doctor. When used as prescribed, oxygen therapy can improve your ability to exercise, improve survival, and increase quality of life for patients with severe and very severe COPD. Thank you for watching the second video in our series on managing your COPD. Please be sure to watch all 4 videos in our series. Here are some resources for finding more information on what was discussed in this video.